Alberta Health Services. Healthy Albertans, healthy communities, together.
And good afternoon, everyone. I'm David Wyant, Chair of Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. To start, we, the AHS Board, would like to recognize that our work takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. We also acknowledge that many Indigenous communities have been forged in urban centres across Alberta, and our reach goes beyond Alberta for this meeting. Our board members are joining us from across the country, and we acknowledge their Indigenous peoples' territories in which they work. Today, I am very pleased to introduce 4 new board members who are joining us. We have, in alphabetical order, Deborah Apps. Deborah is an experienced board director and charitable sector leader with more than 30 years of experience in government, healthcare, education, and the arts. Tony Dagnoni, Tony, who has an impressive career spanning nearly 40 years in healthcare, patient safety, and public service, includes hospital leadership and board service at the provincial, national, and international level. Sherry Fountain. Sherry is an Alberta business person, educator, private equity investor, accredited corporate director, and lawyer with a strong experience in corporate and commercial law. Natalia Riemann, Natalia, who brings additional board experience, legal and small business experience to AHS's governing body. Welcome all. Clearly, my brief introduction does not do any of them justice, and their biographies are available on the AHS website. I am confident that these impressive professionals will be a tremendous asset to this board and to AHS, and accordingly to healthcare in Alberta. Indeed, since being appointed earlier this week, they've not only spent many hours in orientation, but have also participated in meetings all day today and some in committee meetings yesterday. I would also like to thank and acknowledge former board members, Dr. Brenda Hemmelgarn and Mr. Hugh Somerville, QC, for their years of service to Albertans through this board. Today we have 2 motions for consideration, but first, AHS President and CEO, Dr. Verna Yu, has some brief remarks about the importance of kindness during this pandemic, as well as an update on the COVID-19 vaccination rollout. Verna?
Great. Thanks very much, David, and good afternoon to everyone. I'd like to start by also welcoming our new board members. We all look forward to working with you to make Alberta health system the best it can be for all Albertans. I'd also like to thank Dr. Brenda Hemmelgarn and Mr. Hugh Somerville, QC, for their significant contributions to this board and to AHS. So today I'd like to share a few thoughts about kindness. Throughout this pandemic, most Albertans have gone out of their way to express their appreciation and gratitude for healthcare workers. These acts of kindness have helped our people get through many grueling and difficult days on the front lines of our pandemic response. To these Albertans, I wish to say thank you on behalf of all of us at AHS. Your words and deeds mean the world to us, and we know your thoughtfulness and gratitude represent what lives in the hearts of most Albertans. Sadly, there have been a few instances in recent weeks where our staff, including public health inspectors, immunizers, and other frontline workers, have been mistreated, verbally abused, and disrespected while carrying out their duties. And this is not okay. I understand COVID-19 restrictions can be difficult and that this is a stressful time for many Albertans. And I know sometimes stress can lead to heated emotions, but harassment and abuse are never appropriate ways to express frustrations to anyone. So today I'd like to ask Albertans that if they have an interaction with a member of the AHS team, please treat them with kindness and respect. They are here to help all Albertans and keep them safe. They are here to be good partners to communities across the province. They are here to work with businesses to provide further clarity on how to operate safely during COVID-19. And yes, part of the job can involve upholding public health guidelines set out by the Government of Alberta and the Chief Medical Officer of Health. Their jobs are difficult during the best of times and have been made even more so by the pandemic. Please remember that our people are Albertans too, and everyone is dealing with upheaval in their own personal and professional lives. COVID-19 is not easy on anyone, and we are all in this together. So let us remind ourselves to treat one another with kindness during this public health crisis, and that will help us get through this together. Finally, I'd like to provide a quick update on the COVID-19 vaccination rollout. As you may know, AHS expanded COVID-19 vaccinations province-wide just before Christmas. We've made long-term care and designated supportive living residents a priority, as there's no question that these residents have borne the brunt of this pandemic, with more than 60% of Alberta's COVID-19 cases reported within these facilities. Our teams did an incredible job of getting shots in arms very quickly and vaccinated, and about 50,000 eligible residents and staff in AHS long-term care and designated supportive living facilities in under 3 weeks. This is a huge win in our fight against COVID-19, but of course there's much more to do. We know many people are anxious to be immunized for COVID-19, and the major issue we face right now is vaccine supply. We would love to get the vaccine to everyone right now, but the fact is we don't have the product supply to do that. We will continue to urgently triage vaccine supply as it becomes available, and as we continue to work with Alberta Health on the rollout, we will ensure to communicate transparently and openly to all Albertans. I encourage Albertans to get immunized against COVID-19 once they become eligible. The vaccine is our best weapon to end this global pandemic. For now, though, please continue to follow basic public health measures that help reduce the spread of the virus. This means wearing a mask in public areas, maintaining physical distancing, vigilant hand hygiene, and adhering to all public health measures. This will help protect yourself, others, and the health system. Thank you for listening and for your interest in Alberta Health Services. And back over to you, David.
Thank you, Verna. I'd like to reinforce comments made by Verna and make it clear that this board supports AHS staff, physicians, and volunteers, and will take whatever steps are necessary to ensure our people can do their important work safely without facing mistreatment or abuse. The staff, physicians, and volunteers deserve your respect, not your wrath. And as I have said before, if you are for some reason incapable of controlling your urge to vent, please put it in an email and send it to me. Next, I would like to address some administrative matters. We are participating by telephone conference today, obviously. So when I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion passed. May I ask that someone move approval of the agenda that has been circulated?
David, it's Deborah Apps. I move approval of the agenda as presented.
Thank you, Deborah.
I second.
Thank you, Tony. I appreciate that, Tony. Thank you. Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. You've all seen the minutes from our meetings on November 23rd and December 16th, 2020. Are there any issues or questions? Hearing none, may I ask that some... I'm sorry?
Was that November 26th minutes? I think you said 23rd.
My apologies. Thank you for the correction. Are there any issues or questions? Then may I ask that someone move approval of both sets of minutes that have been circulated?
I make the motion. Vicky Yellowwold woman.
Thank you, Vicky. Will someone second the motion?
Brian Vanasjo, I'll second that motion.
Thank you, Brian. I know that the 4 new board members will refrain from voting on the minute approval as the meetings preceded their appointments. So are there any further discussions? Any opposed or abstentions? The motion is carried. Thank you very much. I would ask Vicky Yellowwold woman, Chair of the Community Engagement Committee, and congratulations, Vicky, and thank you for taking on that role, to present the Community Engagement Committee report.
Thank you, Chair.
So the Community Engagement Committee met on January 22nd, 2021. The committee is presenting one item today for board approval with respect to the appointment of Dr. Chris Eagle as trustee of the Calgary Health Foundation. The responsibility to appoint trustees to established foundations lies with the Alberta Health Services Board. The committee recommended the board approve the trustee appointment as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointment of Dr. Chris Eagle as trustee of the Calgary Health Foundation effective February 5th, 2021 for a term of 3 years.
Thank you, Vicki. May I have someone second the motion?
Linda Yates, I'll second that.
Thank you, Glenda. Is there any further discussion on this motion? I'll call for a vote. Any opposed or abstentions? The motion is carried. Next, I would ask David Carpenter, as chair of the Finance Committee, to present the next motion.
Thanks, Mr. Chair. I've been asked to present one motion for approval today. The board was asked to consider for approval an amendment to the Outpatient Cancer Drug Agreement between Alberta Health and Alberta Health Services. The board has considered such amendment, and the members support the approval. Accordingly, I move that the Alberta Health Services Board, firstly, approve the amendment to the current Alberta Health Grant Agreement for the provision of cancer pharmaceuticals to outpatient cancer patients for the term April 1st, 2020 to March 31st, 2021, to increase the funding by up to $45.3 million for newly approved cancer drugs on the terms and conditions reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And secondly, delegate the authority to the AHS President and CEO to execute the agreement to effect such amendment on behalf of Alberta Health Services in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. I so move.
Thank you, David. Will someone second the motion?
Sherry Fountain, I will second that motion.
Thank you, Sherry. Is there any further discussion? Are there any opposed or abstentions? The motion is carried. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you again for joining us. Please stay healthy.
Together, we do amazing things every day.